We've been involving service users in many of our planning groups. We've been talking with groups of users that exist already in the community. We've also been talking widely with the various carers networks. We want to make sure that they feel at the heart of the arrangements for the future.
I do part-time work with Dorset Mental Health Forum, and I was stuffing envelopes and things. Then I became a service user representative. Well, since starting the course, I've been promoted. I don't just go to the committee meetings and things and give a representative view. I'm also phoned up and emailed on a consultancy basis.
Having a personal budget has helped Richard control his post-traumatic stress and anxiety by enabling him to study for a doctorate in mental health matters.
Instead of using day services, I use my money to pay for the tuition and classes with the university, which allows me to do what I want to do rather than doing something that other people want me to do. It's very nice to be able to think that the freedom and the flexibility that I've been able to enjoy with the direct payment for the mental health will be reflected in the individual budgets for the mobility and the personal care package that I'll be able to get. So I won't be reliant on just who the council send. I can then employ someone that will suit me.
In future, eligible service users will know up front how much money is allocated to them, so they can choose what they want to buy, as long as it meets the outcomes in their support plan. But how will people know what they can buy?
What we need to do is to make sure that they've got a good range of information available to them about what's available in this locality that can give them help. Now, people get information in all sorts of different ways. They might get it through the web, they might get it down the telephone line, they might get it from reading, they might want to talk to people about what's available. And what we're planning to do is to make sure that people can meet those needs in all sorts of different ways.
Transforming social care will mean the County Council will work much more closely with other organisations in the future.
Well, by working together, people should experience a much more integrated response, so that when we provide services, they can experience, if you like, a one-stop shop approach where they don't have to tell their story to different people and being handed round the system. By working together, we can do it much more efficiently, and the patient experience should be much better.
It means working with independent and voluntary sector agencies to diversify or widen out the range of services they can offer to people.
So it gives us a new opportunity to refresh our services, and obviously working in partnership, it's much better. You know, no one can work in isolation anymore. We need to work in partnership, and we need to listen to our older people and what they want from us for the future.
We asked some people at the Acorns Day Centre what they think about having more choice.
I think that would be a very good idea, and I think that it would be nice if we could use that money to take on a trip sometime to get us out. It's very nice here, we're all happy here, but it's nice to think that we could have something to do outside.
I don't mind managing money because I've had to do it since my husband died, and I do it all.
Well, not everybody wants to manage their own care, and it's important that we provide the range of advice and support to enable people to take as much control as they actually want to.
I don't know, I've never benefited by it in the past, being told I could do something else or go somewhere else. This is all I've ever known.
Some people, of course, will need to have services in residential care or in nursing homes or whatever. And although that's a last resort for many people, we've still got a commitment to make sure they're high quality services and that we do put their personal needs first. And make sure that where we are providing that, we're affording people the kind of dignity and respect that they deserve. But putting people first is only really going to be effective if we have an eye to the quality of life of all our citizens.
So, Dorset's Transforming Social Care programme aims to provide easier access to information, direct control for service users, a quicker service, increased independence, more integration with the NHS, increased partnership working with voluntary and private care providers, and a greater choice of support options.
These are big changes, though, and really to reap the rewards of all of these changes together, it's going to take a few years to get there, but we've started on that course.
It's brought a lot more into my life because I'm able to do so much more. I feel complete. I feel like a person now.
Yeah, the budget really now has given me the opportunity of doing things I couldn't do before. It's something to look forward to live for, really.
The process for social workers is exciting, it's challenging, and it gives you the opportunity to use your traditional social work skills and values for the benefit of your service users.
So I think it's a really important opportunity for us to look jointly at how we deliver services focused on the patient, the needs of the client, customer, and we can do that effectively together.
It is a great opportunity for services not only in the voluntary and community sector but statutory services as well. It's going to fetch its challenges. We're going to need to see how we are going to provide the services that people want, but overall it's very exciting and I'm looking forward to it going ahead.
It's got to be really exciting because it's going to be even more flexible. We find it great as it is now, and with the extra flexibility it's going to just make life a lot easier for us.
The whole area of life has changed. I used to sit around in the flat and come out once a week to go to Dorset Mental Health Forum and, do nothing really, and now my life's completely changed.
It's a very exciting time. I've worked in social care for more than 30 years, and it's the biggest series of changes that I've known, and it's the most exciting opportunity to develop good social care services for this 21st century. Our staff are up for this challenge. They know they've got real good opportunities here to build services that will meet people's needs in much better ways than the ways we've been able to achieve before. What an exciting prospect for the people of Dorset.
To find out more about transforming social care, you can log on to www.dorsetforyou.com/transforming social care. Or further information can be obtained through speaking to your care manager if you're an existing customer, or new customers can contact Dorset Direct on 01305 221016. There is also further information in the other chapters on this DVD.